Hi, I'm Jaime Ackerman. I'm a PA in Atlanta and have been working in GI for 20 years. I see many adult patients with IBS-C in my practice, approximately 5 a day. My patients often tell me that the symptoms of IBS-C, constipation and pain and bloating, make them miserable, and that they have to plan their life around their IBS-C. I want to do everything I can to help them find relief. The introduction of IBSRELA for the treatment of adults with IBS-C has been exciting for me. Having a medication with a different mechanism of action, and the first in its class, has given me more options to offer my patients, and importantly, different classes of medications for my patients. I let patients know that I will do everything I can to make them better. I want my patients to feel confident that I can help them, which is why it's important to let patients know there are different medications available and that we will keep trying different things until we find what's right for them. But I don't want them to think we're just throwing medications at them. I want them to know that we actually have a strategy, a plan. So explaining that there are different classes of medication and that if a medication in one class doesn't work, we'll go to another class, helps give patients confidence and hope. The first step in treating IBS-C is asking the right questions. You don't know the answer if you don't ask the question, and the way we ask questions is important. If we just ask a patient if their symptoms have improved, we don't get at how much their symptoms have improved. The question doesn't differentiate between a little improvement or a lot of improvement. So instead of asking, has your bloating improved? I ask, are you still having any bloating? If the answer is yes, I dig in to find out more. How often are they having bloating? How much of an impact is it having on their quality of life? So instead of asking if their symptoms have improved, I ask if they are still having symptoms. That is my starting point and helps me make sure I don't miss patients who will be a little better but still suffering from symptoms. And it's important to know this because with more treatment options available, if a patient is still having symptoms, I want us to consider trying a medication that works differently, that is part of a different class, because my goal is to help my patients get as much symptom relief as possible.
What is IBSRELA? IBSRELA, tenapanor, is a prescription medicine used in adults to treat irritable bowel syndrome with constipation, IBS-C. It is not known if IBSRELA is safe and effective in children less than 18 years of age. Important risk information. Do not give IBSRELA to children who are less than 6 years of age. It may harm them. You should not give IBSRELA to children 6 years to less than 18 years of age. It may harm them. IBSRELA can cause severe diarrhea, and your child could get severe dehydration, loss of a large amount of body water and salt. Do not take IBSRELA if a doctor has told you that you have a bowel blockage, intestinal obstruction. Before you take IBSRELA, tell your doctor about your medical conditions, including if you are pregnant or plan to become pregnant. It is not known if IBSRELA will harm your unborn baby. Breastfeeding or plan to breastfeed, although IBSRELA is not expected to pass into your breast milk and to harm your baby. Talk with your doctor about the best way to feed your baby if you take IBSRELA. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Side effects. Diarrhea is the most common side effect of IBSRELA, and it can sometimes be severe. Stop taking IBSRELA and call your doctor if you develop severe diarrhea. Other common side effects of IBSRELA include swelling or a feeling of fullness or pressure in your abdomen, distension, gas, flatulence, or dizziness. These are not all the possible side effects of IBSRELA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch. Please also see medication guide within the full prescribing information.